Hello everyone,
Well,
welcome to the new episode of Professional Unplugged. I am your host Utkarsh Shukla and let me introduce you to my guest Dr. Nudrat. Dr. Nudrat, thank you so much for accepting our invite.
pleasure for me to be with you again. Thank you so much.
Thank you so much Dr. Nudrat. So let's begin with a very basic question. Can you please introduce yourself to our audience, like who you are, what work you do, anything you want to talk about yourself?
Sure. So my name is Nudrat Malik, and I'm a dentist from last 13 to 14 years. I have worked across many countries like India, Mauritius, and Dubai. Presently, I'm based in Jumeirah One, and I call myself dentist by heart and art because I'm very passionate about what I do.
That's really great. You should be passionate about what we are doing. And so can you just enlighten us on the same? What made you passionate about dentistry and how you end up being a dentist? Like your story.
Okay. So basically, as a student, I was never a studious student. I was one of the last bencher, and we used to study, just one night before and used to clear the exam. There were no pressure in terms from the parent side as well, because none of them, like, coming from a very educated background or anything. So as a kid, we were just like, free flowing, whatever we are doing, just good, those kind of things. And till class 12th, I had no idea that I wanted to become a doctor or anything. That white coat always fascinates me. I always want to have that white coat. But I know myself that I'm not those kind of, studious student who can make efforts and all that. I used to like, laugh on myself. That is like, that's a dream kind of thing. And then my brother was also, he's also a doctor. So he was preparing for pre PG that time. He was just 1 or 2 year elder than me. And for him, it was second attempt, and he failed in his second attempt. Of course, the exams are very difficult, tough, and all that. So my parents took out that pressure of, you should become a doctor or go for PMT and all that. So I was very happy that I will just go do a BSc, a simple course, and then after a few years I will get married. And this there was no ambition at all. But then when I went to the one of, I took admission in the in BSc course, and I find it extremely boring. And I felt like that this is not the place. I should have, like, I should at least start making efforts. And that's the time I started, decided to let me give a try to PMT. And PMT is pre-medical test. So my brother was already going to Kota to the Ellen Institute for preparation, and somehow I also cleared the entrance test for that, and I ended up there. And that's where my journey began. And of course, because I never studied before, so my brother used to top from first 100. Every 15 days we used to get test there, and then just to encourage kids, they will always give you a booklet of what is your rank, where are you ranking, so that you can prepare yourself for the competitive exams. So in those booklets, my brother used to come from first 150 pictures. He will always be in those pictures, and I will be always from the last 150. Like, there were 1,000, 1200, 1500, 1,500 students around, and that's where I used to lie. But then somehow I decided, and then next year I continued giving PMT. I took the second attempt, and in the second attempt, I met an accident, a road traffic accident, and I lost my upper front teeth. So whatever you see, it's by the dentist, on the dentist, long time back. So and that was my first experience. I've been to a dentist chair, and it's not that inspired me to become a dentist or I wanted to do that, anything like that. But that was my first exposure. And then second exposure, dentistry chose me because my marks was little less to get into medical field, and that's how I'll end up into dentistry.
That's really a long story and a great story as well. Like you mentioned, you have gone through the same thing of dentistry and from there onwards you get to know more about it. So as a person, like generally most of the people in the eastern part of the southeast part of the Asia avoid more of a dentistry thing, right? So what's your thought on this? And do you think it is changing by time?
From India to Mauritius to Dubai, by far, the fear of dentist is a very common thing. People don't want to go to dentist. First thing is, awareness. There is no awareness on dentistry. So, and people think like, you have 32 teeth. So whenever you get a problem, you go to a dentist. But the thing is in dentistry, normally you say prevention is the cure. In dentistry, prevention is the cure. You go to dentist, you keep it regularly and finish then and there. Don't wait for the problems to come in, because once it comes with lots of pain, pain on pocket and pain, like, not only dental pain, but the mental pain as well, because it is scary to be on that dental chair. It's improving. I won't say that it's not improving, but still it's a far way to go. There is, even in Mauritius, there was no much awareness about it. And even in Dubai, I don't know, maybe it's people are educated, but people are still, not very keen to go to dentist. They still prefer to go when we go to, when they will go back to their home country, they will get the treatment done.
Right, I totally
So
agree.
this is still there is, but yeah, of course it's improving.
Correct. So how was?
Did I answer your question?
Yeah, you answered my question pretty well. Like there is still a lot
Okay,
of
thank you.
myths for the dentistry all around the southeastern part of Asia. Right. So let's jump to our next question. So what was the main thing that kept you motivated on your path towards dentistry? Like what were those things, or what were the challenges that you have faced?
So, in terms of, because I was, maybe I never studied, but the time I started studying for PMT, that's what, give me the, like, it taught me how to study. So afterwards, everything becomes easy for me. As a student, I was always, as a student of dentistry, I was always like a good student. I was never like, the last bencher anymore. I was like still masti-core, but nobody will count me into, she doesn't know anything. If people have to ask a concept, they will come to me and ask me. By the final year, it was like this. Of course, even the first, second year, I was like, one of the intelligent kids in the class. And so as per challenges, those reduces as per how to prepare for exams and how much study you have to do, this and that. But for me, the biggest challenge was I'm a lefty turned into right-handed dentist. So normal on a dental chair, the position of dentist is fixed. Always the dentist will always stands on the right side of the patient and do the treatment. But me being a dentist, for me, like, everything is upside down. But touch wood, I'm not a gross lefty. You can say that I'm an ambidextrous one. So I started, one of our teacher, they guided us, when you become a dentist, it will become very difficult for you to know left side and right side, because on the left side, the area become very limited because there is spittoon and everything for the patient to spit and everything. So you can't work from that side and you have to be on the right side of the patient. So that was the biggest challenge, from converting from left to right. That was my challenge. But with practice and with just to stick to that I have to overcome that. I did. Even in pre-clinicals, when kids, what we have to do the preparation on dummies, and dummies are generally, the jaw will be placed in a dummy, right? So it will be a proper mouth where you are working. But most of the students, being student, everybody take that out, fill the cavity outside, and then you get it clear. But for me, because I know for this stage it's easier to do that, what I will do in patient's mouth, because there I cannot take the tooth out and do and put it back. No. So I stick to that, and that was the difficult time for me. But Alhamdulillah, that Alhamdulillah, passed very well. I learned well.
I totally agree with you on that left-handed issue. I'm also a lefty, so I know how sometimes it can be
Okay.
difficult for us to cooperate with the things, especially with the instruments and
Yeah.
all those things.
Yes, and
And
few of my friends, they are still lefty and they still perform left-handed dentistry. It's not possible, but yeah, there are limitation of, positioning and all that.
correct.
So for me, like I don't get those problems at least now.
And you just mentioned like you were following the holistic approach while studying and during your internships as well. So I think if any advice you like to give to the new people who are coming to the dentistry or the young students, what it will be?
Young students, all I can advise you, go to the standard books, don't go to the shortcuts, go to the Bibles of that subject, read them. The amount of, the knowledge you will get from those big books, because they are explaining the whole concept, where it come from, when it come, and everything behind that. So that is what, and this is the thing about storytelling as well, right? When you know the why it's happening, you will remember it better. So it become easier to anything to to remember the concept. So my request to everybody, even not for dentistry, for any profession from any field, just go through those standard books and gain best of the knowledge. Uh, uh, Practice under somebody who is very good at dentistry, who is already following all the norms in dentistry. It's very common. What happens, like, oh, practical knowledge is different and applied knowledge is different. People generally, put these things separately. But to me, whatever it's in the book, it came from the experience only. And that is already applied knowledge. And if you apply and combine those knowledge to your practice, that will be, there's nothing better than that.
I totally agree with you, like following the holistic approach and going through the Bibles of the country.
Yeah.
So how you try to maintain the relations with your patients? Because it's very important for patient to trust the doctor that they are consulting, right? So what are the steps that you take? Yeah.
Yes. So, see, first of all, it is a big task from getting somebody coming to a clinic and making them your patient and retaining them. That is like, where your power lies. And I think it's all about gaining their trust. I think it's based on three things. First, what you are doing, you should be good at what you do. If you are doing something what you are good at, it will be, reflected in your personality and people will trust you easily. Second thing, you have to be relatable to them. So that also plays a big role. You find them relatable, or you say, yeah, like she knows what we are going through. And it's not like, this is what I always, because I've been on that dental chair very early in age. So I know how it feels like on dental chair. What are the things you feel like uncomfortable? What is the pain you go through? So I always try not to give them any pain, or not to pain, not to give, but minimally. Not giving pain, it will be a myth in dentistry. But yeah, whenever possible, minimally painful, minimally discomfort, not even painful. Painful, I don't work on pain. And apart from that, I explain them very well. When I'm talking with them, I will tell them that whether this tooth is going to survive, it's not going to survive, and all the details around that, so that people know they can make their own decision what is good for them. I help them with that. And one more thing I do is, even few procedure which I don't do, I still tell them that what could be good for you. It's not about the money, but it's about the service. I'm getting paid by, they will pay me for my consultation, right? So if it's limited to, it's my duty to tell them what is good for them. Whether, for example, I don't do implants, but still, if a patient comes, I will inform him that implant is the best option for you. Then, if he doesn't choose on the basis of, it's a surgery or it's expensive or whatever, that's up to him. But it's my duty to explain what are the options to be taken. So, if you are truthful to your patient, you will retain them over the time. They will not question you, and that trust makes a very big thing to retain the patients.
I totally agree with you. As a patient, it is important for you to trust your doctor and to get over the feedback
Yeah,
that
and
he or she is trying to give.
yes, and healthcare is one thing that the moment you feel like that this is, this is like they're just trying to take money out of me. The moment you get that feeling, you will not enter that clinic again, no matter how you like. Maybe the services are good, but still you will not go because of somewhere it will stay in your mind. Oh, it's like they are just into money.
Right.
So to me, service is very important in when you are in service based, especially in healthcare.
That's a very honest answer from you, I have to say.
Yeah, yeah.
This last but not the least question I like to ask is what's next for you? I mean, what is your dream now?
Dream right now, I don't own my own practice, so I want to have my own practice which will be considered as standard of dentistry, that when people are coming to Dr. Nudrat, they are not thinking what will happen, how it will happen, like the most trusted brand in dentistry. That's what I want to build, and I want to create that's how you do dentistry. Like there are no shortcuts, but best of the ways how you can do that.
It's really great. So you want to create a brand out of your dentistry, and that will be a global brand,
Yes,
right?
yes.
Not only in Dubai.
Yes, inshallah. Yes, inshallah.
All the best.
Anyway, there is lots of unemployment around dentistry. Field is super saturated nowadays. Anyway, all fields are super saturated, and even in Dubai, it's super saturated. It's very difficult to find jobs, and most of the clinics are suffering in terms of getting the right amount of patient and all that. So, but yeah, keep your hopes high and keep doing what you're best at.
Yeah, that's nice. I think that's the best point we can end this interview. So thank you so much, Dr. Nudrat, for sharing your insights and knowledge with us. I hope it was a great session for you as well.
Thank you so much. Thanks to you, Utkarsh, what you are doing. Giving people guidance, I think that's the best thing what you can do. Just maybe for us, it's just a story. We're just telling what happened, but somebody might get inspiration out of that, and that could be life changing for them for sure.
Thank you.